Hello, David Sweeney from Dublin to Chiropractic. So I've had an email there from two patients. So the first one, interesting neck pain issue, broken rib, can't sleep, lying on the back or side for the last 2 months. So the kind of neck's been in a really weird unsupported position when she's sleeping. So neck's very, very bad at the moment. I know the patient, I know what I usually do for the patient as well. And then we've got a new patient inquiring about her neck as well. So I'm going to run through some exercises that I think will really, really help. These are things that I do. So the first thing I want you to do, if you have a foam roller, to grab that, and then you can, against the wall, just pop it right through here. And I just lean my whole body weight into those key areas. Sometimes I need to shift it around a little bit. Lean down slightly, like that, like that. Really hitting those spots right there. When I find a really difficult spot, really tender spot like that, I just stay on it and wait for it to ease off. And that's it right there for me. Nice. You also have another option here, the baseball. I don't really like it because it's just a little bit awkward to, see what I mean? It's just a little bit awkward to get into it like this, right? I'm just trying to, you can isolate the levator scapula muscle, which is kind of attaching onto the apex there, of the scapula, and it is a bit rougher, definitely, but I find the foam roller is just a little bit better. It's more effective just hitting everything at once and getting it all done really quickly. Right, so folks, you've done your deep tissue work. Maybe you've started with the foam roller, then you've done the baseball if you want to really hit some key areas very deeply. Now we need to stretch the upper trapezius musculature here, and also the little group of musculature in here called the scalenes, and that attaches actually into the more distal part of the clavicle. The clavicle is the collarbone, and then this is the proximal part of the clavicle right here. Collarbone, so the inside part of the collarbone, and this muscle here, can you see that? Call that the SCM muscle, and that needs to be also stretched. So moving on, grabbing the chair like that. Just moving the head away from my shoulder. Now this arm doesn't do much. I could actually just sit like this, but I'm just going to add, I don't know if you noticed that, it's a tiny little bit of pressure. That's all you're doing here. Okay? Now we can hit the more posterior component of that, including this muscle called the levator scap, by simply turning the head like this. Again, just holding that for maybe 30 seconds, maybe 1 minute. Now we want to try to hit more of the scalene and this SCM muscle. So I like to clamp the collarbone down with this hand. So I'm just using the meaty part of this hand here. We call it the chicken, the drumstick, right? You see that? It's kind of like that's actually what we adjust on as well a lot of the time. That's a great way for me to contact your spine and push into it. We also use this part of the wrist as well for adjusting. But see this drumstick part here? If you just put your hand like that and place it across the collarbone, I can really anchor it down. And I use this hand as well to create a little bit of support. Now, if I just turn my head away and tilt all the way back, I'm getting a really nice stretch here. Now, if I take these hands away, that's not doing, I can't feel anything at all there. So you have to clamp down the collarbone. So guys, sorry about the audio on this clip. I'm just doing a voiceover on this, and what I'm explaining here is how we put the thumb out straight in front of our face like this, and the purpose here is to increase our range of motion. So what we're going to do is move the thumb laterally out to the side to about 45 degrees, follow that with the eyes, okay, and then turn the head. I didn't do it quite very well that time, so
I'm following with the eyes to there, and now I'm going to turn the head there, just like that. We go a little bit further, turning the head after the eye movement. Same here, only to 90 degrees. So we never ever pass 90 degrees. And we do that both sides 2-3 times. Yeah, so I also wanted to add in this little rotational exercise as well. I just forgot to film it. That's for the upper back.
You know the classic, you push the head back into the hands, you push forwards like this, push to the side, push to the side. Now imagine you're turning your head to the left, push against that, turning the head the other way, push against that as well. My favorite one of all time is to actually keep the posture really perfect. Imagine you're being lifted upwards. Now the fists come right underneath the chin, like that, and we're just pushing up and resisting the upward push of the hands. Just like that. Now I'm not trying to overwhelm my head or push it right back. I suppose if I thought about it, if I could push with 100% force, I might be pushing with maybe 10, 15%, maybe 20% upward pressure that I can physically manage. That my neck always feels amazing after that. So if it's feeling really stiff and tight up and around here, I get straight into that. I do that all the time actually when I'm adjusting patients. So if my neck's feeling really bad, and that's happened to me a lot of times. So what's interesting is when I'm doing a manipulation, maybe on someone's middle back, and I forget to keep my posture up, my head up, and I push down and do that adjustment, oh my god, I can get like so much force comes into my neck and really jars it up, and it feels really tender after it. And I come in and I'm pushing up in through here and creating that resistance, stabilizing all of the deep muscles in the neck here and at the back as well. There's another alternative to that where some people like to do these chin tucks and retractions like this. We're just pulling the head back, but do you know what? I discovered after a few years of trying that really it wasn't as effective as this upward lifting. And there's been a few times actually in practice where my neck has been absolutely killing me, and if you're a patient of mine, you know that I get migraine headaches as well. I've sometimes explained that and explained how the neck, especially this bone up here, C2 and C1, right up in through here, when they get really stuck and jammed up, what they can do is start to trigger a migraine for me. And many of my patients suffer with that as well. So when those neck joints get really jammed and jarred up, sometimes you just really need to be adjusted, and the exercises will help and hopefully reduce your symptoms, but you probably just need to be adjusted as well. But one little strategy I've used in the past is to try to relax the muscles around it. Now the foam roller is a part of that, but sometimes in the practice I don't have a foam roller, so I'll literally come up here and clamp. I just clamp those muscles really hard, like that, and that feels awful. Sometimes I'll just move the head away from the resistance, and that will increase the pressure. So a clamp here, a clamp here. Now those two fingers, let's see if we can do it. So those two fingers there are pretty strong as well. I don't know if you know that, but if I was to massage behind my neck, I could use the index finger and the mid finger, which would be fine. And sometimes I go all the way through the muscles at the back of the neck. And I'm just using a circular motion. Sometimes I'll clamp and press deeply into an area that's not responding or is really tense. You're going to feel that. You'll definitely feel the pain off it as well. So what I like to do is actually use those two fingers here. Okay, those are really strong. And I come in and I'm just doing a self massage all the way through the neck, and it really always feels quite nice afterwards. So you might add that in with the foam roller stuff there as well. Okay, so this is my secret weapon for really difficult neck pain patients. Now you might be able to replicate what I'm going to show you with maybe a small kitchen towel or hand towel. And I better just show you how this works on the floor here, okay?
Sorry for the audio on this clip here, guys, so I'm doing another voiceover. And sorry about the floor as well. We've painted the floors and we were planning to get them redone. New floors, new carpets, and the lockdown happened, so we haven't been able to do that. In this clip you can see I'm using the Dental Orthotic. My head isn't supported here, by the way, guys. On my x-ray, look how straight that neck is. 17 degrees of curve. We should really be at 35 degrees. So this dental device or neck orthotic helps stimulate that curve back into my neck. So it relieves a lot of pressure for me there as well. Now the thing about it is, really we have to determine if it's suitable for you in clinic. Sometimes it can feel how much tension there is in the neck, and safely recommend that if someone has cardiovascular issues and are an increased risk of stroke, we won't be using something like this. If you want to try to do a little bit of stretching in this manner, use a small tea towel that you're going to roll up into a cylindrical shape and just put it in the middle part of your neck. Now you notice my head isn't being supported by the floor there, actually, if you go back and look at that clip. And the reason for that is it's supposed to traction the neck. So if you're going to try this, make sure the towel is going to be up a little bit higher so that's possible for you. And the other thing is, of course, I'm going to be spending 1 to 3 minutes in this position to start with. Currently I can do 10 minutes there, no problem at all. So hope you enjoyed the video here, guys, and please subscribe to the channel if you haven't already done so. We've just started this in the last week, so your support really means a lot to me. And yeah, I'll see you hopefully in practice soon for your next adjustment. Cheers.